have with us Dr. Mrinmoy Mitra, who is currently a consultant pulmonologist at ILS Hospital, Saltlake, Kolkata. How do you think people should detox after inhaling all that smoke-filled air?
So better you go for prevention. Wear mask if you are allergic to that specific fumes or that allergen. Better to avoid that place. Avoid firecrackers. If you have any sort of respiratory illness like asthma, COPD, interstitial lung disease, the better way it is better to prevent those areas and use mask if you have to go there.
Those who suffer from respiratory diseases, how can they take precautions before stepping out from their homes?
Use mask, use hand hygiene. So this is the common term to prevent respiratory infections, because any sort of respiratory infections like viruses, bacteria, we inhale directly through the nose and mouth from our respiration. So we need a barrier system to prevent this. The barrier system is the mask. So use mask, use your hand hygiene, and take vaccination, mainly influenza vaccinations, pneumonia vaccinations of elderly people who have multiple comorbidities like diabetes, chronic lung problem, cardiac problems, kidney problems.
What are the ill effects of using masks for an extensive period of time?
Generally, if you use N95 more than 12 hours at a stretch, it can cause hypoxia. It decreases the oxygen level in your blood. The patients who have chronic respiratory problem, lungs problem, use the N95 mask very cautiously. Generally, use of 3-ply surgical masks is good enough. Maintain the hygiene of the mask. If you place the mask here and there and then again reuse it, the chances of respiratory infections from the mask itself increases. If you're using cloth mask, then wash it properly. Suggestion would be proper hygiene of the mask is important.
Recently, West Bengal Pollution Control Board has launched a Paribesh app through which people can easily access all the air quality index, noise quality index in whatever area they want to visit. How do you think the judgment of the air quality index will help for a person who wants to travel from one place to the other?
For travelers who have respiratory problems, like a patient who has asthmatic, who has allergic rhinitis, who has COPD or interstitial lung disease, when he moves from less polluted area to a severe polluted area where there is a predominance of smog, so the patient may be cautious if you see the Paribesh app before going to that place.
Thank you so much, sir. It was wonderful talking to you. With such an informative session with Dr. Mitra, we are sure our audiences will become more aware regarding their health. For more such news, keep watching Paribesh News with environment for environment. And don't forget to like, share and subscribe to this channel.